I think really, what would be the top 1, 2, 3 things that we need to do to really scale across the country to create that pan-Canadian ecosystem that allows us to really show that Canada is a player in the international community in terms of health data and analytics, and what we can do to really demonstrate to our colleagues across other government sectors, departments of finance, et cetera, that investment has a return. And I think those kinds of things would really be helpful and meaningful to me, and that's what we really need to achieve today.
The advantage of digital health data collected from many, many sources and a huge volume of data is that it allows us to learn more about individuals and focus on them. For many years, the standard source of evidence, in quotes, because it hasn't been very good evidence, that we have used for making decisions are like publications, randomized controlled studies in medical journals. They compare one group of patients against another group of patients, and they find on average that this group of patients did better than the other group. But it tells us nothing about the individuals in those groups. So within the group that did better, there were undoubtedly patients that did worse. Within the group that did worse, there were undoubtedly patients that did better. The result of that has been when we used that information to treat patients, 30 or 40% of the time the treatment didn't work because we were looking at groups, not individuals. With digital data and all the information available from electronic health record and even social media and all other sources, we can learn more and more about the individual. And that allows us to make better decisions for that individual and improve their health care by focusing on them rather than just lumping them into a population of patients.
If I had to talk about what I might do differently, I think the thing I would try to focus on is what is stopping us from doing the sort of things that Own the Podium does. So I think there's a lot of great ideas, but why is there not the uptake? It was raised in a couple of meetings, a couple of sessions yesterday about how do we actually advance to the next phase. And I think we need to think carefully about, in spite of all the evidence we have, what are the 2 or 3 things that are really stopping us from advancing it, and focus on those and say, how do we actually remove those barriers? What's it going to take? Because I don't think it's a small task.
Well, the one that stood out for me was the notion of health data as a public good. So one of the ways to think about this is that the evidence that we have today comes from data that people that were there before us provided so that researchers and clinicians could analyze those data and could get a better understanding of what affects our health over the life course. And I think there's a sentiment that sharing data for health research and for health analytics is part of the public good, and then making that data available to everybody in a broad sense is an important development.
It's important to recognize that just putting the information in front of our managers, if we've not had the capacity of doing that before, people aren't going to do things differently on Monday morning just because they have the data. So that issue of capacity building is very important, and also that data analytics is not artificial intelligence. So it doesn't replace the intelligence behind that information. So one of our first speakers yesterday really clearly articulated the importance of defining what it is that the problem that we want to serve, that we're trying to solve here. Also, what's the vision? What's the future vision of what we want that to look like? And then, how does technology help us to achieve that? I think too often we see these data analytics approaches as the solution rather than the tool that helps us reach our goal.
I would have to say that I'm coming away with much more positive view that we're actually doing something, that this isn't just a theoretical discussion. I've been at a lot of these conferences in the past, and I've always found them very good, and the people are outstanding, but I've kind of come away and said, well, that's a nice conference, and I enjoyed listening to people, but how do you actually put a stake in the ground and move forward? I'm actually quite upbeat about the fact that there's a lot of positive stuff going on.